Hello, everybody. I'm ready to teach. I hope you're ready to listen and learn. So today we're going to talk about oncological emergencies. So give me a second here. All right, we are ready to start. So oncological emergencies. What is an oncological emergency? It's any acute life-threatening condition that directly or indirectly is related to the client's tumor or the treatment of the tumor. So the first one we need to know is sepsis and DIC. So sepsis is an increased risk for an infection, particularly gram-negative organisms in the bloodstream. And DIC is a life-threatening problem that is associated with sepsis. So interventions for this would be, these two would be sterile technique on all procedures and administer antibiotics as prescribed and administer anticoagulants in the beginning, in the early phases of DIC. And when needed, then you would provide the clotting factors. Now, on most NCLEX type questions, they're not going to give you sepsis and DIC. You're going to need to know the signs and symptoms of these. I'm not going to go over that, but I just want you to know that you should know those. So the next one is syndrome of inappropriate antidiuretic hormone. This is because tumors can secrete or stimulate the increased amounts of antidiuretic hormone in the body. As nurses, we need to be mindful and watch for increased fluid retention that could lead to water intoxication and weight gain. We need to monitor their serum sodium levels because they could drop below 110, and that could cause seizures or even death. So, interventions for this would be a fluid restriction, increase the sodium intake as prescribed, administer the antagonist for the antidiuretic hormone. And a lot of students have trouble with this. They can't remember if this is holding or getting rid of. Antidiuretic means I'm not peeing. So if I have an inappropriate amount of it, then I'm not peeing at all. I'm really holding fluid. So I would want to give the antagonist, which is going to reverse that. Again, I'd monitor the sodium levels and I would treat the underlying cause, whatever caused the syndrome of inappropriate antidiuretic hormone. Okay, then the next one is spinal cord compression. This occurs when the tumor is entering the spinal cord or when the spinal cord collapses because of that tumor entry. And it's impinging on the spinal cord itself. Signs and symptoms would be like back pain that occur before those neurological deficits occur. So interventions would be to assess for back pain. And then the neurological deficits, we would be giving high doses of corticosteroids. As ordered, we get the patient ready for radiation and or chemo, surgery if needed, and the use of a neck or back brace as prescribed. And hypercalcemia, this is because of late manifestation of extensive malignancy, referring to the bone metastasis, and the bone is releasing that calcium into the bloodstream. So early signs and symptoms would be fatigue, anorexia, nausea, vomiting, constipation, and polyuria. More serious signs and symptoms would be changes in their ECG, dehydration because of that osmotic diuresis, paralytic ileus, and diminished deep tendon reflexes, and of course, severe muscle weakness. Interventions would definitely be to monitor that calcium level and the ECG. We would give oral and parenteral fluids as ordered, and give meds to lower that calcium level, give antiemetics because they're going to be nauseated, dialysis if we need to, and encourage the patient to walk to help push some of that calcium back into the bone. Then we have superior vena cava syndrome. This occurs because the superior vena cava is compressed or obstructed by a tumor growth. Most common, those are lung cancer and lymphoma that it happens. Signs and symptoms would be edema of the face, especially around the eyes, or tightness around the collar. Then they can have dyspnea, erythema of the upper body, epistaxis, which is bloody nose. And then interventions, things that I need to do for this patient would be to put them in semi-Fowler's position, give them corticosteroids and diuretics as ordered, and prepare the client for high-dose radiation. Then tumor lysis syndrome. This is when large amounts of tumor cells are destroyed rapidly, and then the body dumps potassium and uric acid faster than the bloodstream can get rid of them. So with hyperuricemia, you can have kidney damage, and it can cause acute kidney injury. So if it's untreated, you can actually have death. The interventions for this are to encourage oral hydration, IV hydration as ordered, monitor those renal functions, intake and output, renal diet with low in potassium and phosphorus, diuretics as ordered, any meds that would increase the excretion of the purines, IV infusion of glucose to treat the hypercalcemia, and then dialysis if nothing else is working. Okay, now I've gone over these relatively quickly, but I want you to notice, and I'm going to scroll back. I want you to notice that hypercalcemia isn't in here. Weight loss isn't in here. And it all goes back to the definition of what an oncological emergency is. It is an acute life-threatening condition that's directly or indirectly related to the patient's tumor or the treatment of that tumor. Understand that weight loss and potassium are not related to any of what we just covered. So that's why they're not in there. So don't be thinking that if you get an oncological emergency question that you would be dealing, those would be. They are not, okay? Again, I hope that my teaching here on YouTube is helping you. And I hope that if you ever need any help with your nursing, that you would give me a call, okay? Hope you have a good day. Bye-bye.